Thank you all for joining us this morning. We have Joy Gray with us. And before I introduce Joy, I just wanted to let you all know that this webinar is being recorded. And so staying on the webinar, you are giving us your permission to be recorded, and this recording will be posted on the ABIN website. We're so glad you're here this morning and joining us. And we're pleased to introduce Joy Gray. Joy Gray oversees all tobacco and control activities for Arkansas. This includes the statewide and community subgrantee programs, the National Tobacco Control Grant from the CDC, as well as the prevention and cessation activities unique to the Arkansas Department of Health. Joy is one of the creators of Be Well Arkansas, which is the only state-operated tobacco quit line in the nation and is in its 4th year of operation. Arkansas Department of Health also has Be Well Baby, a program for pregnant smokers, and she's one of the writers and creators of Coral Reefs, a brand new anti-vaping prevention program and youth in grades K through 2. With that, we're going to turn it over to you, Joy, and I'm so excited to hear from you about tobacco cessation, the Be Well program. It's a fantastic program. We refer to that, and I can't wait to hear more about what you all are doing.
Okay, well, good morning. Thank you all for having me here today. And as she said, I'm just going to be talking a little bit about identifying and addressing tobacco use in a primary care setting, especially with an emphasis on if you have patients that have any sort of behavioral health or substance misuse issues. And hopefully, once we're done today, everybody who watches this will be able to take the information they need and just confidently address this in whatever kind of healthcare setting that you're in. This is my agenda for today. And at the end, we'll have a slide that has my information on it. So if I miss something, or if you think of a question later on, that is totally fine for you to just email me or give me a call, and I will get together with you and answer any other questions or cover anything that I might not have touched on today that you want to know about. And I'm going to talk a lot about the National Institutes of Health today because they do a lot of fantastic research on tobacco cessation. And one of the things that they love to stress, and it's very important, and I stress it as well as much as I possibly can, is that if a person is smoking, vaping, using whatever kind of product they're using, if they're advised by a clinician to quit, they're 6 times more likely to try quitting, and then 1.6 times more likely to successfully quit. So just that information coming from a clinician will help people. We have people call us all the time that say, my doctor told me I need to quit. My therapist told me I need to quit. We even have people who say, I'm making my dog sick and my veterinarian said I need to quit. So that is how impactful it is just to have someone who is some sort of a clinician telling people that it's important. So hopefully today I stress this importance to y'all, but everyone who is a clinician seeing patients, y'all are the frontline people that are out there helping us with cessation. And we do cessation here, but making sure that cessation is embedded through systems all across Arkansas is something else that we're really passionate about. Now, on this next slide, I'm going to show you a video. And it is a testimonial from someone named Reuben Holman, and he was referred to Be Well by his physician. And we're going to listen to his story real quick. And let me know, pop up in the chat if you cannot hear this. You should be able to hear it though.
I'm Reuben Holman. I work for a construction company building chicken houses, and I've got to do a lot of walking. My doctor, because of some health reasons, suggested I quit smoking. I've been smoking for almost 50 years, was unable to quit, tried several times. The doctor got in touch with the Be Well program, and they got in contact with me. Those folks were absolutely wonderful. They called me every week, and they gave me encouragement. They sent me the lozenges, and it was all for free. They want to help you quit, and they're very sincere and very good about it. Before I quit smoking, I couldn't walk half the distance of one of these houses without being out of breath, having to stop for air. Now that I'm a non-smoker, I could run to the end of this house, and they're 600 feet long. That's 2 football fields. I haven't had a cigarette in over a year. I don't crave it, don't want another one. In fact, they kind of smell bad now. Before, when I was smoking, I didn't realize the smell that I was emitting and making people suffer with. I feel so much better now that I'm a non-smoker. I can smell better, taste better. My overall health is much better. People who smoke don't realize, what they're doing to themselves and their health. The Be Well helpline will help you quit smoking, and it's worth it. Your children are worth it, your future. They helped me a lot to become a healthier, better person.
Okay, so that was Reuben Holman, and he is a fantastic spokesperson for quitting tobacco and quitting at the recommendation of your doctor. And he is a real person, he's a real caller, and that is one thing that we've been doing the past few years is making sure we get testimonials from real people, because that's what Arkansans really like to see. They like to see real, authentic people who have actually quit, that are just like them, that are just like their neighbor. And Reuben is a great example. And he's actually such a good example that we cut that into 30 and 15-second generic spots where it takes out all the Arkansas stuff. And he is actually being used in Utah, and they're test marking him in Florida. So he is actually being used around the country because CDC actually just fell in love with him. And they love that particular testimonial because it is such a real person. And he's very much a guy that we all kind of know in rural America. And he'd been smoking, longer than I've been alive. And because his doctor referred him, he was able to quit. And so we're really happy about him, and we just love him to death. So I'm super proud of him, and be on the lookout for more of these that come out through the next few years. So here we have the statistic of the adult smoking rate in Arkansas. I'm not going to spend a ton of time going over the smoking rate. I want to kind of give you just sort of a glimpse. So right now we're at 20.5%. That's actually down. We actually, a couple years ago, were at 22.5%, and now we're at 20.5%. Now, that is great, and we're happy to be going downward, but we need to keep that trajectory heading this way for sure. And that's definitely something that clinicians can help us with. Each percentage point we go down represents about 25,000 Arkansans. So now, 2 percentage points means we're down about 50,000 smokers. So that's really good. We want to make sure we keep that number moving downward. And
Medical.
there we go. And so now we are here at the American smoking rate. So nationally, the smoking rate is about 60%. So obviously, we're not doing as bad, as we could be, obviously, but we definitely have room for improvement because we always want to try to get under the national average if we possibly can. So we have a ways to go. That would be 100,000 people that we would have to get to quit smoking to get to this number. So we're going to keep working on it, though, and that's part of what y'all are going to help us with. That's something that y'all are probably doing in your practice every single day, is trying to help people quit. We are currently 44th in the nation on smoking. So again, we're not all the way at the bottom, but as per usual, Arkansas is usually in that bottom 10 or in the bad top 10 or in the bad bottom 10. And we are again with tobacco usage. So that's something we definitely want to try to work on. And I'm throwing in other tobacco products. Most of what we're going to be talking about today is combustible cigarettes and smoking combustible cigarettes. That is still the biggest issue, especially with adults. But I do want to throw this up on the screen. So about 7% of adult Arkansans are using vape products, right? And then we also have about 6.4% that are dipping or using snuff and snuff products, those little pouches that go in your mouth. And then down here for high school students, it is dramatically higher. And this is data that comes from the CDC. So we have 24.3% of high school students that have used a vape product in the last 30 days. And then we also have 7.3% that have used some sort of dip or snuff product in the last 30 days. That is very, very high. That is higher than the national average. And it's definitely something that we need to work on. Now, this data did come out in 19, which was right before the national T21 law went into effect. However, I do still know, because we are in the community and we're out there in schools, and y'all probably know this as well, that high school students and younger, middle school, are very much still using vape and vape products. So even though it was made illegal, and that is very helpful, for us that it was made illegal long term. That can be something that benefits us as a state and as a country, but we have absolutely still got to work on this. Because part of the issue is, one, we know vaping is dangerous, full stop. It is not safe. It's not really safer as it was marketed in the beginning. And youth who vape are 7 times more likely to become smokers later on. They are what we call dual users, which is where they will start smoking because now they've already been vaping. What difference does it make? And then because vaping is expensive, when they become adults and they don't have their parents, helping fund their life anymore, they will move to cigarettes, which are cheaper. So today, youth that are vaping are going to become tomorrow's adults that smoke if we don't go ahead and intervene now. So when you are talking to your patients, if you have young patients, go ahead and try to talk to them about vaping if you can. Be aware that you may use a word like vape or e-cigarette, and they'll say, no, I don't do that. But if you say, do you use something like a Juul? They'll go, oh, well, yeah, I do that. Because we found that people were telling us, oh, I don't use e-cigarettes. I don't vape. I Juul, though. And we're like, oh, God. So we've had to change some of our surveys. We've had to change the way we phrase things because we have to meet them where they are and use the language that they use. And so that was one of the things that we learned. So in your practice, if you have used for adults, but specifically youth that you think might be using these products, it's okay to say a product like a Juul if you think that that's going to be impactful for them and get a better answer. So 5,800, just under 6,000, that is how many Arkansans we lose every year from tobacco. And that is a very unfortunate statistic. This does not just include cancer, this also includes if someone is smoking and it has led to heart disease, asthma, COPD. This is all the different diseases and deaths that could be related to smoking. And this is what we have annually. Nationally, about 500,000 people die every single year from tobacco. And tobacco is the only product on the market that kills about half of its users. So that is an interesting fact there, and it's one that, it's legal. There's not much we can do about that at this current moment, but it is definitely not something that is safe. And as we'll see later on through the presentation, it is not a coping. It is not a coping mechanism, and it's not something that we should be letting people do. I'm going to just very briefly talk about the impact on the body because as clinicians, you probably already know a lot of this, and this is something that isn't going to be super new for you, but I'm going to give you a little bit of extra information. I did say earlier that we were not the worst with smoking. We are the worst in the country for heart attack death, period. So Arkansas is the #1 right now, which is not a good thing to be, in heart attack death. So we have acute myocardial infarctions at an alarming rate here in the state, and we have deaths from them at an alarming rate here in the state. And we also have, across the board, we have higher rates of asthma, COPD. We have higher rates of diabetes, specifically type 2 in the state of Arkansas. And then we also have high rates of cancer. Specifically, we have a higher rate of lung cancer than the rest of the country does. And this may be information that you all already know. And of course, as clinicians, you already know that smoking either causes or worsens everything right there on the screen. However, because we run our own call center and because we actually talk to these people every single day that call in, what we know is that a lot of people, just laypersons out there in the state, do not realize that smoking is causing or worsening all of these things. They know that smoking causes lung cancer. And part of that is on public health. Public health did a really good job for the last 30 or so years of explaining, hey, smoking causes lung cancer, lung cancer, lung cancer, lung cancer. And we have beat that horse all the way and beyond. However, public health, people like me, did not do a good enough job of connecting tobacco use to everything else. And so people will call us before they get lung cancer and say, I want to call before anything bad happens. And we say, oh, you never had any physical issues? And they say, oh, well, I've had a heart attack and I've had a bypass and I've had this. And they'll name all these different ailments that are probably directly caused by their tobacco use, but they don't realize that. So that is something that would be a huge help for us. We're trying in public health to get the word out there, and we try in public health to explain, but it can be very impactful during those one-on-one interactions, and especially when we get on to how to advise people later on in the presentation. This is something that can be really helpful and useful in letting if you have a diabetic patient that's also smoking, they need to know that tobacco use is absolutely worsening their diabetes. So that is a personal favor that I would ask is if we can have some help making sure people are aware that this is not just lung cancer. Smoking is not just a lung cancer thing. You know, COPD, I mean, we literally have people call us that do not understand that the smoking is why they are now on an oxygen tank. They really, I don't know exactly all the reasons why, other than, again, public health did really great with lung cancer, but not much else. But any help that we can get, making sure people understand your whole entire body is impacted by your tobacco use. I would personally consider that a personal favor because we definitely need help with this. And next, we're going to talk just a little bit about the impact on mental health and tobacco's impact on the brain, and specifically a little bit about if you have patients who have substance use disorder and how you can make sure they still quit, even though for the past, I don't know how many years, that has been a bit discouraged. So people that have some sort of behavioral health condition make up 25% of the population. However, they're smoking 40% of the cigarettes that get consumed in the United States. So 25% of the population, 1/4 of the United States is smoking almost half of the cigarettes. So we obviously know that this is definitely a rampant issue in the field of behavioral health. And believe it or not, quitting smoking actually helps decrease the symptoms of depression, anxiety, and other behavioral health problems that are out there. That is not a pervasive belief. I can tell you, I worked in mental health and substance abuse treatment for over a decade, and that was not, the belief was definitely let people quit smoking. They have to have something. If they don't have something to latch onto, then they're going to relapse. And as we'll see in later parts of this presentation, that's actually just not the case. But nicotine really grabs a hold of the dopamine and serotonin levels in your brain. And it makes quitting so much more difficult. Quitting is hard anyway, but the way nicotine interacts with the chemicals in your brain, and also all the different additives that are placed into cigarettes that make everything much more addictive, specifically menthol, and it makes everything much, much more addictive. And it's difficult to quit, even if you have absolutely no mental health diagnosis whatsoever. It's hard. But if you're someone who's already struggling with an imbalance or issues with your serotonin and dopamine levels, smoking makes smoking that much harder to quit. And what they found in all the different research that's going on out there is that dopamine, you get a little spike of it when you smoke a cigarette. So when you smoke a cigarette or when you inhale the smoke, when the nicotine hits your lungs, which then immediately quickly sends it to the rest of your body, because the lungs are a great carrier for anything that needs to be placed all throughout our body. So as soon as that happens, your dopamine levels go up a little bit. But then over time, the longer you smoke, the more they go down. So then what ends up happening is, and this is going to sound real familiar for anyone that works with addiction, once the dopamine starts to go down, now we have to smoke more to get that spike up, right? So in order to get that pleasure center in the brain stimulated, now we got to smoke more. And then that leads to it being lowered down again more, which leads to it being up more, which is the cycle of addiction, right? So that is the cycle of any chemical that becomes addictive to a person. It's pretty much that exact thing with nicotine. And we constantly refer to smoking as a habit. The media, the world treats smoking as a habit. It is an addiction. Nicotine is an addiction, period. And until we start treating it that way, we're not going to make much headway with it. So with your dopamine, again, it triggers that little spike and then down and then up and then down. And then over time, it's going to flatline and you're going to have to really smoke to drag it up higher. And then with your serotonin, same song, second verse. It is almost the exact same thing. People get that little boost and they feel like that mitigates their depression. They feel like I'm not as depressed when I get to go smoke. Or I'm really anxious and I'm really nervous. I need to go smoke a cigarette. Well, nicotine raises your blood pressure. It raises your heart rate. It's a vasoconstrictor. It in no way does anything to decrease anxiety. It masks that feeling for just a minute. And oh, I'm sorry. Okay, sorry. But it also, it makes people feel like they're, getting rid of their anxiety for a few minutes, because usually when you go smoke, what do you have to do? You have to go outside. So if you're at work and something catastrophic is happening and it's driving you crazy, and you go outside and smoke for a few minutes, yeah, oh my God, you're so much better, I'm calm now. Not because you smoked, it's not because of nicotine, it's because you got outside and away from those people that are driving you nuts for 5 minutes, right? But people associate that feeling with the nicotine. And because it does the same thing. It spikes the serotonin for just a minute. It gives you that little boost. And then over time, it drives it back down and then up and down and then up. And then, so now you've got someone who already has issues with their serotonin and dopamine levels to begin with. Now they've introduced nicotine and cigarette smoke into the equation. And so they have dragged both of them down. They're having to smoke more to get up, and then it keeps dragging it back down. So it is just a vicious cycle of addiction, and it is the same with any addiction. And nicotine is exactly the same. So we need to be treating nicotine as an addiction, and we need to be offering people cessation as much as we possibly can. And historically, cessation was thought to be something that would negatively impact outcomes when it comes to substance use. And like I said, I worked in a facility for a long, long time. People would be addicted to a variety of substances, both legal and illegal, and they would still be allowed to smoke. They would get smoke breaks. And one thing I will definitely tell you anecdotally is that we would notice when they were trying to come down off of other things, they would absolutely smoke more. So that is something that was just a pervasive, nonstop issue, was they're coming down off of whatever else they're addicted to. And in order to fill that void, they self-medicate more and more and more and more with tobacco, right? So, and we know if we have more people with mental illness smoking, then we know we have more people with mental illness and behavioral health issues dying from tobacco. So it is killing them additionally at a very high rate. And so now what we know through years and years of research, and the very last slide of this presentation, when it gets saved, and if someone needs it, I have a whole bunch of links to different peer-reviewed information about this if anybody's interested. But again, the NIH tells us smoking cessation does not have a negative effect on people who are trying to quit various substances. It actually has a positive effect. So it is not something that we need to allow people to keep doing just because we think it helps. It actually does not help in any capacity. And so when someone is being offered clinical services, whether they are for physical or psychiatric care, smoking cessation should be offered as well. And this is just a quick little graphic. So adults who have been diagnosed with a substance use disorder, 2 out of 3 of them are smoking. And then for adults who might be in treatment for dependency of an illegal substance, they also smoke. So that is a sharp statistic for me. So we know that people in treatment are smoking. We absolutely know this, and we know people who are diagnosed and are being treated, they are smoking. And so when we are offering them treatment for everything else that they are struggling with, we need to go ahead and offer them tobacco cessation as well, because it's better for them physically and psychologically to go ahead and quit everything at once if at all possible. One concern that we hear a lot is, well, if people can't smoke, they're going to relapse. They can't do something. They got to do something, or they're going to go back to whatever they were using. And I call it the myth of positive tobacco use, because it is just that. It is a myth. There is no positive use for combustible commercial cigarettes. Absolutely not. And if we allow them to continue using products that are nicotine related, whether it's smoking, vaping, dipping, whatever, it actually increases their chance of relapsing to the other substances. Part of this is because smoking typically accompanies illicit drugs, right? If we see someone who is using an illicit drug, or even if they're just addicted to prescription drugs or alcohol, things that are actually legal, we know that people usually will engage in that addictive behavior and then also smoke right before, during, or after. So part of that is just that response of, it's sort of that Pavlovian response. They smoke cigarettes, and they know when they were normally smoking was also a time they were using something else. So their brain starts to connect those two activities. That's part of it. Another part of it is there is some research and some studies from the National Institute of Drug Addiction that shows that nicotine exposure increases craving and for stimulants and opiates. So there is some mechanism in the nicotine, probably related to the dopamine and serotonin issues that we discussed earlier, that causes people to want opiates and stimulants more so than people who do not use nicotine. So it's a vicious cycle of smoking, smoking when I'm doing other things that I don't need to be doing, and then also the nicotine just causing my body to want those things. So there is absolutely nothing positive. There's nothing useful. Smoking does not help people with their addiction, and it will actually cause them to relapse. Another thing, if you've ever worked in any of those kind of facilities like I have, we encourage people when you go home, can't be around the same people you were around. You can't be doing the same things that you were doing, right? And one of the things that we've got to stop people from doing is smoking and engaging in all the things they were before that lead them back to those addictive behaviors. Smoking is one of the number one things that we can stop from, right? So we can say, listen, don't smoke cigarettes. Well, everybody I know smokes. Well, maybe you don't need to be around everybody you know right now. Maybe you need to be around other people who have healthy behaviors and that don't smoke and that don't do anything like that. So it is definitely something that it is a total myth that smoking helps people not relapse. No, it will absolutely drive them backwards in their treatment. So what can you do? So you've gotten, kind of a quick drive-by of information. What can you as a clinician do? So ask, advise, refer. These are the 3 easiest steps that we can possibly give you to help your patient in a clinical setting. Ask. So you should ask all patients that you can if they're currently using tobacco or nicotine products. That does include youth, if at all possible. I know some places it may be set up in your EMR. That question only pops up at 21 and up because that's the legal thing now. However, if you have a patient, especially a young patient that has a persistent unexplained cough or some other symptoms that make you suspicious, if you can ask, please do. And like I said in an earlier slide, you may have to use a name brand like Juul, like are you using a Juul or Juul type product? That may be something that you have to work in. Anybody who is, 21 and up definitely needs to be screened for tobacco use, whether you smell it, suspect it, or whatever. It just needs to be a standard question. And then if someone says that they do use nicotine, you've got to see if they're interested in quitting. So, you are a smoker. Are you interested in quitting? If they say no, don't be pushy and, try to hide your disappointment as we all do. But take the no as a not yet. And we'll talk about that on a kind of next slide when we talk about how to make referral. And the next step, after you've asked the question, once you know that they are using tobacco and nicotine, it's the time to advise them on the importance of quitting for overall health. Now, you do need to, obviously, it's perfectly fine and okay to talk about the physical maladies that come from smoking, right? If you've got a patient in there for their diabetes or for heart disease or whatever, or for substance misuse or any sort of mental illness, whatever the problem is, it's important to tell them this problem is going to get worse if you continue to smoke. Avoid doom and gloom and making it sound like it's, they're going to die tomorrow. Don't do that because we don't want to scare people, but we want to make them understand how important it is. And if you can provide them with any kind of positive outcomes, these are your patients, you know them. And if you know somebody loves to fish, maybe talk about how much more they can fish, how much better they can fish, and they can catch bigger fish, and they can lift them by themselves if they'll stop smoking and build up that lung capacity. So any way that you can advise people in a way that is positive and talks about the positive health outcomes is great. So do keep in mind discussing the negative health impact, but in a way that doesn't make it sound like, the old Saturday Night Live get Debbie Downer. We don't want to sound like that because that's not motivational for people. And then stay non-judgmental and not pressured. Okay, so don't pressure people. Keep the advice as non-judgmental as possible because specifically people who might be struggling with substance misuse, that particular demographic is already feeling judged about having to go get help. And so if you add an additional judgment about their nicotine use, that's going to drive them further away from quitting. We want to drive people towards quitting, and we want to keep the advice positive and focus on all the good things that will happen when you quit, not if you quit, when you eventually get ready and quit. So that's where the first step comes in. Even if someone says no, let them know that help is still available when they get ready. So when the time comes, remember, not if, when they get ready. And I put on here if they are ready. So if they're ready that time, but when they get ready eventually, you're going to be there to help them, or we will be there to help them. A lot of places have in-house cessation, which is wonderful. If you have an in-house cessation program at your facility or clinic, absolutely set up a referral. If they say, yes, I'm ready today, then go ahead and do it then. If they say, I'm not ready, then give them a mechanism to call you back when they are. So if they say, well, I'm not ready, don't just leave it up. Okay, well, they're not ready. Okay, you're not ready today, Thursday, but if next Thursday you're ready, call this number and have them call your facility and get referred to your in-house cessation. If you do not have in-house cessation and you are interested in having tobacco treatment specialists at your facility or clinic, on the slide that has my information, shoot me an email and I will let you know, because we do provide, the Department of Health provides free of charge trainings for people to become tobacco treatment specialists to provide cessation. And it is a free program that we offer here, and we use the University of Texas and their program that is a accredited program through MD Anderson at University of Texas. So stay tuned, use my email if that's something that you're interested in and that you would like to have. And it can be any kind of doctor, clinician, it can literally be anyone. It could be the person who is at your front desk. If you want them to be a tobacco treatment specialist and talk to your patient, you can do that. Just contact me later on and we can talk about it. Now, if you do not have in-house cessation, that's where Be Well Arkansas comes in. That's where we pick up and we take over for you. Be Well Arkansas is free. It's for all Arkansans age 13 and up. We give nicotine replacement therapy, or NRT, to patients that are over 18 and over 100 pounds. So if you have a patient that comes in, they're 15 and they're vaping and it's out of control, they can call us and we will counsel them. We'll send them materials if they want, and we'll talk to them as much as we need to. Usually it's 4 sessions, but we can do more. And if they're in some sort of juvenile delinquency program, we can provide them with a certificate saying that they started or completed the program, whichever they need. So if you have youth that are using these products, we can help them. Now, once they are over 18 and over 100 pounds, we do send them free patches and lozenges. Medicaid patients get a prescription that they can redeem at the pharmacy for free, and it is for 90 days worth of patches and gums. There are 2 easy ways to enroll that we're going to talk about, but it is also homegrown health. And I'm going to talk about that on the next slide. Exactly what does that mean? So homegrown health, when you call Be Well Arkansas, or when you have a patient call Be Well Arkansas, these are the people that they're calling right there on the screen. And I want to give you all a very high level of comfort with calling and using our service and letting you know they are here in Arkansas. If I were to turn my background screen off and point the camera, you could see the call center right outside my door. So these people are here in Arkansas to help you. So this is Arkansans helping Arkansans. So when you refer people, they are not calling some far, far away call center out of state. They are calling here. They are calling people that work for me. And these people are tobacco treatment specialists. They are also, I think all but one of them is a certified life coach that can assist anybody that calls if they have questions on how their tobacco use relates to their diabetes or hypertension. And these wellness counselors are very passionate about getting people to quit tobacco and nicotine products. And we started in 2018. We're the only state-operated call center in the nation. And our current quit rates are higher than the other call centers, and our engagement rates are higher than the other call centers. Part of that is because when you call Arkansas, Be Well Arkansas, we have your client, they're going to stay with the same counselor through the whole time. So other states, you just sort of get thrown into like a bingo hopper, and whoever is not busy that day is going to call you and do your counseling session. For us, when you get assigned to a person, you stay with that person through your whole journey. You have the ability to build rapport, speak to the same person over and over again, and know that you have a connection with that person that is invested in you quitting. And that is a feature that is unique to Arkansas. So I just wanted to show this to y'all and let you see that we are really here. We are really in Arkansas. So when you refer your patients, you are going to be referring them here to us. And there are a couple of easy ways to enroll. And obviously they can call the 283 well number, toll-free number here in Arkansas. Also, if they call the 1-800-QUIT-NOW that CDC advertises all the time, that also goes here. So we do pick up that number as well. So either one is perfectly fine. And they can also go online to bewellarkansas.org and sign up 24/7. That's an online registry. And when you go and register online, your first counseling session is the first phone call. So it is a true online enrollment where we're not just getting your name and number. You're really filling out the whole intake, and then it comes straight to our system. And then the first call is us doing your first counseling session. And after you complete that first counseling session, that's when you get the free NRT. This is also the spot where I'm going to take a second and let y'all know that we're not just here for your patient or your client. We're also here for you and your staff. So having worked in this kind of environment before, and specifically in behavioral health and substance use, I know that a lot of the people who work in these facilities smoke a lot. And it is not necessarily discouraged because it's like, well, it's stressful. Yeah, people smoke. But it can be hard to talk to patients about smoking and quitting smoking when you reek of cigarettes. So it's free for you, it's free for your staff, it is free for anybody. So I would very much encourage, if you have people working for you, or if you yourself are a smoker and want help quitting, we are also here for you too. We're not just here for people that are seeking other types of treatment. And when you go to bewellarkansas.org and you click the healthcare provider tab for free resources, this is where you can locate things like this. We've got magnets, posters, we have wallet cards, postcards, lanyards, a little pop-up tent there. We have all sorts of stuff that you can either display in your clinic or give out to the people that come in so that they have something in their hand that they can take home. And when they decide they want to quit, they can call us and we will help them. And I just put this just right real quick on here. And this is just an actual screenshot of the website. And you just click that little tab at the top there that says healthcare providers. And then once you click that, you will get these 6 buttons here that will help you either get free resources, or you can click up there in the top left and it says refer your patient. That's where you will find the fax referral form. We do still take those. So if that's something that you feel like you need to do or that your clinic requires, you can go get that fax referral form right there under the refer your patient button. And you may also notice that there at the top, we have a couple different tabs. One says Be Well Baby and one that says Youth Education. I'm just going to give you a quick rundown of those super fast. Be Well Baby, this is a program for pregnant smokers. So if any of your clientele are pregnant, then they can enroll in this. This is a separate program. They get a 10-call protocol instead of 4 calls. They do not get NRT because it is contraindicated for pregnant women, but they do get more calls. They get 4 prenatal and 6 postnatal calls. As they matriculate through the program, they can earn vouchers for free diapers redeemable in Walmart stores and at Walmart.com. So that is something up to $250 worth of free diapers, which, I mean, I know kids probably go through that in like a week, but it's still better than none. And then there is also the ability if someone lives in the home with the smoker that has enrolled. So if you live with the pregnant smoker, if you're the partner or the parent of the pregnant smoker that has enrolled, the partner or parent can also enroll, and then they can also earn diaper vouchers up to $150. So if a pregnant smoker and her partner, they both want to quit, they both enroll, they can earn up to $400 worth of vouchers for free diapers at Walmart if they just go ahead and enroll and complete the whole program. So that is a separate program that we offer. There's easy enrollment, bewellarkansas.org, click the Be Well Baby tab, and there's 2 buttons. A person can either enroll themselves or use the clinician to click the enroll button and enroll them there as well. So it's really simple. We made it as easy as possible for people that are interested in quitting. And then also, she briefly mentioned in my intro, we have started Coral Tree, which is a youth education program for grades K through 2. There is nothing else like it in the country. I know because I spent the last couple of years researching, trying to find something, and it is prevention that is focused on vaping and nicotine. All prevention right now starts in 5th grade. And we discovered in our time working here that 5th grade is honestly too late. By the time 5th grade comes, they're already vaping. The problem is everything has been structured to start at 5th grade for the last 20 to 30 years. And so we created something that goes all the way down to kindergarten. It is a cartoon program, and it has auxiliary materials that are based off of it. And then we will have books and other things to accompany it as time goes on. But it's fun and engaging, and it's fun and funny. And then they also learn something as well. It's not necessarily beat them over the head with education, because we know that does not work. So feel free, if you go to bewellarkansas.org and click the youth education tab, the video will pop up. There's free printables that you can get. And then if you wanted to we have little coloring books, things like that. That was something people wanted to maybe put in their waiting room. or have out for kids. If you see pediatric patients and you want to start having prevention conversations, this would be something that would kind of be able to open the door for you. And before I go on and wrap up for questions, I'm going to show you one more testimonial of someone who is able to use our call center to quit. My mouse will show up.
Hi, my name is Maverick Renter, and I live in Little Rock, Arkansas. I've been a smoker for 21 years, and I decided to try to stop smoking because my son asked me to, and that touched my heart. We was riding in a truck one day, and I had a cigarette lit. He said, "Dad, could you put that out and stop smoking for me, please?" I looked at him and said, "Son, yes, I would stop smoking for you so I can be around for you and watch you graduate high school and live your life and watch you grow up." The Be Well program called me and told me that they were going to send me the lozenges and the patches, and I received them 3 days later. As soon as I received them, I started using them. And my son came in my room and said, "Dad, what you doing?" I said, "You see these, son? These are the lozenges to help Daddy stop smoking, and these are the patches to help me too." Those saved me during those times that I wanted to smoke. I feel wonderful. I can breathe like fresh air. I would fully recommend it, the Be Well program, because it helped me tremendously. My son said, "Dad, I'm proud that you quit smoking. I love you." I told him I loved him too.
So that was another one that he's our most recent one, and we love Maverick. And I will tell you, and she won't be hopefully too mad, but our Secretary of Health has seen this several times, and every time she sees it, she starts crying. And she said she just can't help it. The little boy telling the dad that he loves him for quitting, it just gets her every single time. So here is my information, and that is my phone number and my email address. They use my first name on there, so it's lana.gray@arkansas.gov, and then that is my phone number. Feel free to call me or email me if you think of something after this, or if there's something that I haven't covered, or if you need data, if you want coloring books to put in your waiting room, whatever it is, call me, email me. We are here to help. We're here to help you not just have your patients quit, but anything tobacco related. That is what we are here for. And so now I think we have a few minutes. And if anybody has any questions, I am here for that.
Thank you so much, Joy. Yeah, let's open it up for questions right now. We would love to take any questions that you have for Joy and about the Be Well program or smoking, anything smoking related or tobacco related.
Joy, thank you so much for your presentation. I don't know if you talked about the nicotine like pouches, but what would you say about those?
So those are, we kind of just couch that in with the oral tobacco. So that's similar to, are you talking about like the Zen products?
Yes.
Okay, so there's two different types of oral tobacco that she's talking about. So one, it is basically a little pouch of snuff. And that is something that's been around, oh my gosh, it's been around 20, 30 years. For some reason, it's popular in Europe. I don't know why. The other thing that has come out more recently, it's come out in the last few years, and the big name brand for it is called Zyn, Z-Y-N. And it is a nicotine salt pouch that goes into the cheek and gum and releases nicotine. Now, that sounds harmless, of course. However, as we all know, if it comes from a tobacco company, it's bad. I mean, that's just the easiest way to say it. And Zyn is not being marketed as a cessation product. It is being marketed as another way to get your tobacco, another way to get your nicotine. I would say Zyn is probably kind of marketed as something that, for example, if someone wants to smoke 20 cigarettes a day, but they only have time for 15, you can put that Zyn in your mouth and nobody's going to know. That's kind of how it's marketed. So we have no idea in the next 10 or 20 years what happens with the mouth and gum after that's been sitting in there. So we obviously know that if you're sticking snuff, whether it's in a pouch or loose in your mouth, that is just going to tear your gums all the pieces. We know that. I just actually had a meeting with our oral health department the other day for some projects we're working on together. And we talked a little bit about snuff and how terrible it is chewing tobacco. We are a rural state and we do love our athletics here in Arkansas. And, you know, if you go out on any baseball diamond, you're going to find boys sniffing still to this day, even very young ones. So the more we can discourage any kind of nicotine use, we know that that's what we need to be doing. And so because ZYN is not marketed as a cessation tool, then we obviously know that it's not. So that's, I have another presentation I do for adults and vaping where I talk to, you know, it's kind of aimed at parents, sort of showing them what to be looking for. And one of the things I do is I show different ads from places like ZYN, Juul, Thorin, whatever, versus that they all sort of try to act like, oh, don't smoke, just do this instead. And then I show a commercial for Nicorette Go. And if it looks fun and sexy and beautiful and bright, it's bad. Okay, but if it's a bunch of soccer dads, it's a cessation product. So the sexier and more exciting it looks, don't do it. There's a good, you know, our moms were right about that kind of stuff. So definitely we are not here for any of that kind of. Actually, when ZYN first came out, I somehow got a mailer for it. And I brought it to work and was like, oh my God, look at this, you know. And we were all like, oh, right, another thing. But that's the deal with the nicotine companies is, you know, you got to give big tobacco this. They are adaptive. And so they will test something. I don't know that ZYN has caught on really yet. So I'm not as worried about it as I am, for example, Juul, Thorin. There's a couple other ones that are, you know, they advertise bigger pods, more nicotine. You know, those are very worrisome for us still right now.
So thank you very much. What a great presentation.
Thank you.
This was an amazing presentation. Thank you for coming. I had a question about, we've heard a lot about peer recovery support for opioids and for alcohol. And I'm just wondering if there are any kind of peer support programs for tobacco cessation.
There have been previously, I know it was either UAMS or Baptist had some group sessions that they had going on over there for a while. It's not something that ADH necessarily, you know, has that we do specifically now. We do provide training. So if your facility or clinic wants to start groups, there's a program called Dimensions out of the University of Colorado. And what Dimensions does is it teaches people how to provide and lead tobacco peer support groups. And it's not just for clinicians, it can also be for the peers, right? And it's a train the trainer model where the clinicians can take it and then train the people in their group. And we have done it. We had a Dimensions training just recently, and then we had one last fiscal year where we had a clinic in Conway that did it because they were interested in groups. We've also actually had University of Colorado come and work in some of our county jails because those trustee inmates they lead a lot of groups, especially Garland County is really working hard on having a lot of different wellness activities based around just the whole body wellness. And so we decided to reach out to them and see if they wanted to do the training, and they did a couple of years ago. And so they were able to lead peer support groups because you can't technically smoke in the jail, but we want to make sure when they leave the jail that they're also not doing it. Because again, as we discussed with, you know, substance misuse, it also leads you back down a path of everything else. I noticed there's a question over in the chat about the pandemic increased or decreased the quit line. So I can tell you, when we were in the throes of the pandemic, the entire country went way down on calls. And we had people who had enrolled already, and we would call them and they would say, listen, I can't worry about quitting right now. You know, I got all these kids in the house that are going to school right now, and I'm having to work from home and be a teacher and do this and this, and I'm going to keep smoking. And so we ended up having a much lower quit rate. Now that the pandemic has sort of leveled off, so to speak, it's obviously still here. It's obviously still dangerous. And if you are smoking, it is going to kill you. I mean, that is just point blank. Do not smoke, do not vape, and think that you're going to come out unscathed. Because you can get on CDC, you can get on NIH and look and see that the data definitely reflects that people who are struggling the most, dying the most frequently, and having long COVID are people who are smoking and vaping, because it just ruins your lungs. And COVID attacks the lungs, as we know, and it attacks the lungs in a variety of ways, some of which we probably don't even understand just yet. And the best thing you can do is have your body in as good a shape as possible to battle COVID. I can assure you, I actually got flu and COVID at the same time last year. And I'm so glad I don't smoke, because I don't know that I would have come out of it having both of those on top of each other. So definitely that is just another tool in your kit to tell people, listen, COVID is still here. It's still very real, and it's still very dangerous. And the best thing you can do is have your body in as good a shape as possible. And okay, so then someone said, I had a patient ask for specific info on how to quit vaping. Do you have any suggestions? You can treat vaping just like cigarettes. Go ahead. It is not a cessation tool. It is just like a cigarette. Now, here's where it's worse than a cigarette. I'm going to tell you. A pack of cigarettes, right? So there's 20 cigarettes in a pack. A lot of people don't necessarily smoke a whole pack a day, right? They're maybe doing a half. Not that that's good, but they're not smoking a whole pack. One Juul pod has as much nicotine as that whole pack of cigarettes. So if you have someone who's ripping through 2 and 3 Juul pods a day, they're doing the same nicotine as 2 and 3 packs of cigarettes. So that's a problem, because now we have people who are taking in more nicotine than ever before, especially your kids, right? And we definitely have no idea 10 years from now, what are these kids' brain scans going to look like? I'm very nervous. But we know that these people are ripping through nicotine at an alarming rate. So treat vaping the same way. The other thing I would tell you is that with smoking, we know over time, smoking, we know what it does to your lungs. We've all seen the little black lungs, whatever. What we haven't seen enough of, and what we should be seeing, and you can get on Google and look up, MRI from a vapor. There are people, especially young people, who are vaping lots and lots and lots all day long. And it basically coats the insides of their lungs to the point where some of them have had to have lung transplants. Their lungs are not working correctly. Your lungs should not be coated with a layer of vitamin E acetate. They cannot work. They are meant to be clean and empty and bring clean air into your body. That is all your lungs are there for. They are not meant to be layered with flavored juice, which is what is happening. The other thing is, I've talked to some doctors over at Children's Hospital about youth that are vaping, because if a youth is vaping, they're not doing elective surgeries on them currently. They have to wait for the youth to quit, because they cannot pass the lung function test to go under anesthesia. So a lot of these kids who are vaping have a worse lung function than an adult who's been smoking a pack a day for however long. That's how bad it is. And it is an immediate problem, and a lot of people say, well, it's fine, I don't feel bad. And I say all the time, I see these kids, and when I said earlier in the presentation, if the kid has a persistent cough, it's not normal for a 14-year-old to be going constantly all day long. It's suspicious. And if you have a kid who just constantly has a dry cough for no reason, start checking. See if that USB drive is really a USB drive. They make hoodies where the string, you put the string in your mouth and you smoke the hidden vape that's inside the hoodie. It's ridiculous. And don't tell me they're not marketing to kids, because they absolutely are. They are marketing to kids. They are making it sneaky and easy, and they are ruining these kids' lungs, and they know what they're doing. It is the same thing big tobacco did and has been doing for years, where they say, oh, it's not that, it looks cool, it's sexy, and it is just straight up killing these kids. So I would treat vaping just like cigarettes. If someone calls here and they vape, we treat it just like cigarettes. We talk about their triggers, what's making them, want to vape, what can they do to avoid it, washing all their clothes, throwing everything away that might smell like it, even if it smells tutti frutti. You need to get the tutti frutti smell out of everything, right? So we treat it the same way. And if someone calls and vapes, we're going to send them the patches, we're going to send them the QuickBooks, we're going to do the same counseling. It is really same song, second verse for sure. And you can absolutely treat your patients who vape the same way in terms of recommending cessation, recommending treatment. It is not better for them to vape, for sure. Anything else?
Joy, I have a question and I'm curious. One of the things that happened or that could happen. And I heard you talk about screening and asking, all adult patients 21 or older if they are smoking. Is there any research on how long it takes from someone saying, yes, I smoke, and giving them information from the time that they say, yes, I'm interested in getting some support and getting some resources to quit?
So do you mean like how long does it take that patient to make the choice?
Yeah. Okay. And what are you seeing?
What we see now, this is anecdotal, so this is not science-based, what I'm about to tell you, but generally, so I will tell you, if it impacts someone besides themselves, they'll call faster. So for example, if a doctor says, if a pediatrician tells a mom, listen, little Johnny's asthma isn't going to get better as long as you're smoking in the house, then they're more likely to say, okay, I've got to quit smoking for my son. And they will call faster for sure. People are just that way. They are quicker to call for someone else than they are for themselves. And I don't necessarily know all the reasons behind that. I gave the example of the veterinarian telling somebody to quit because we created a whole line of posters and pop-up tents to put in offices for veterinarians because we kept having people call saying, my vet told me I needed to quit because I'm killing my dogs. We had one lady in specific that I always give an example. She called us in tears because she had several cats die of nasal cancer. And she just thought she was the unluckiest cat owner in the world and just kept having these cancerous cats. And her vet just got, as my mother would have said, a gut full of it and said, listen, keep killing your cats with the smoke. Stop it. And she called here that day. She left the vet's office and called that day and called us in tears. And we got her to quit because she wanted to quit because she was tired of killing her cat. But no one had ever told her. It just took someone who was a clinician that she respected saying the word. And so if there's any way you can tell somebody, not just how it's going to help you and your body, but your kids, your grandkids, your dogs, your cats, whatever, whatever it takes to get somebody, if you just have to point out how expensive it is. If you quit smoking, if you've been smoking a pack a day for 20 years, you have roughly spent $40,000. What could you have done with that $40,000? And so even if it's just money that motivates people, but generally, if they have some reason besides themselves, they will call quickly within a few days. If it's a me problem, a lot of times, unfortunately, they will not call until it becomes a physical ailment that they cannot deny. And we still are not at a point with people where they're ready to call just because. A lot of people call because this thing happened. We had, for example, we have a testimonial I did not show y'all of a lady named Jenna. She had nodules in her throat. It wasn't cancer, but those nodules are the thing that got her to go, and say, okay, it's time. Because the next time I might not be so lucky. So we don't necessarily have research on how quick it is from telling them it's bad to them seeking help. But I can just definitely tell you anecdotally, if there's any way you can fold in something besides themselves, that will definitely drive people to go a little quicker.
That's great. So what I'm hearing is, yes, it's important to screen everyone and possibly starting before 5th grade because kids are starting to vape early. And we need to have open, direct communication where we're specifically giving information on how this is affecting you, your health, and everyone around you, and including pets who are in your environment.
Mm-hmm. Oh, absolutely.
That's so important. Thank you. All right, it's 8:59. Do we have any last minute burning questions? Okay. Well, thank you so much, Joy, for coming on today and providing us this excellent presentation. I was so grateful that you addressed all of the continuum of tobacco, right? Not just smoking, but vaping. We're hearing about these Zen products, different products that are constantly hitting the market. And so this is absolutely necessary and so critical for us to know so that when we're working out in our settings, we're able to address the smoking issue. And also, we know we have these fantastic resources in Arkansas. It's amazing to hear about this Be Well and the first program with the coral reefs. So thank you so much. And we're glad you're here and doing all this cutting edge work. Have a wonderful day, everyone. Thank you.